Understanding the new mandate and regulations portion of the 2019 EPCS Click for Control campaign webinar series. We decided to repeat, and I'm glad to see so many people have decided to join so that everybody understands the mandates, the regulations as we near 2020. I'm Connie Ide, the Director of Programs for Health Current, and I'll be your presenter today. You will be muted during the presentation, so please enter your questions into the chat box, and I'll do my best to answer them at the end of the webinar. Please be certain to include your name, practice, and organization and your role so that I can get back to you after the webinar if there's additional information that I need from you or that I have to provide to you. Each of you who have registered and participated will receive a copy of today's webinar slides and the questions and answers asked in the chat box during the call. And the webinar is also being recorded today and will be appearing on the Health Current website in about a week. So let's begin the beginning here. I do want to let you know that this presentation is provided to you via shared commitment from Access, Health Current, the Arizona Department of Health Services, and also the Board of Pharmacy. We saw the need to provide information to all the providers in the state and banded together so that we could provide this information to you. So today's session I'm going to cover the EPCS regulations and mandates, also where we are in Arizona versus where the national landscape is in e-prescribing of controlled substances. I'll also cover a tiny bit of the Controlled Substance Prescription Monitoring Program, although we will have one more webinar on it with Lynn Curtis from the Board of Pharmacy leading it, so I'll be just touching on the some of the very important parts of it. Also, I will cover a little bit of the Click for Control campaign resources, where you can find them and how you can use them, and also review with you again what are the benefits of EPCS and why you really should be doing it. All right, with no further ado, here we go. Just a bit of a review of the timeline of how EPCS came to be. In 2010, the DEA authorized pharmacies to receive and dispense and also archive electronic prescriptions for controlled substances. And then in April of 2012, the then Governor Janet Napolitano signed it into law for Arizona, making it legal in Arizona. And then in 2019, Governor Ducey signed the Opioid Epidemic Act that mandated EPCS to begin on January 1 of 2019 for all Schedule II opioids. And then in January, actually it was in February of 2019, Governor Ducey signed into law House Bill 2075, which extended the deadline to January 1 of 2020. Giving all of us a little bit more time to get up and going. So House Bill 2075 is mostly what I've covered in this, what I will be covering in this webinar. And if you'll notice down in the bottom of each one of the slides, you will see where it says more information on House Bill 2075 is available here. That will take you to the actual bill so you can see the actual text that's there. You also can go to our website for the Click for Control campaign information, and you can click on that here button at the bottom of all of those. I don't know what this is up on my screen, but I have a funny message on my screen, so I will let Sarah tell me what's going on with that. There we go. Guess I got that out of your sight. So specifically, House Bill 2075 removed the waiver process. Those of you that have been around for a while remember that we had to do waivers If you weren't able to be live by January 1, 2019, you could apply for a waiver. The Board of Pharmacy received over 43,000 waivers, which is very amazing because there aren't that many DEA-registered EPCS capable providers in the state of Arizona. But what happened is the larger organizations, such as the Banners, the Honors, put all of their employed prescribers in at every one of their sites. That's what caused us to have so many waivers. But the waivers are no longer necessary, so they don't count anymore. It also specified the Schedule II controlled substance requirements for compounding, which the original bill did not cover, and that's for the direct administration, and it covers the long-term care facility residents as well as hospice care patients. It also clarified what to do if your system was down, so we're going to talk about that today. It also clarified, and I'm not going to cover a whole lot about this today, but it confirmed that veterinarians are not required, if you have friends that are veterinarians, are not required to EPCS until their state veterinary association is able to identify that there's enough EPCS veterinarian software out there to make it available for them to do. Some other things that have gone on in Mandate 2075 is that prescribers may write and fax a Schedule II controlled substance that is an opioid. And you'll notice that I've used the exact words out of the bill, Schedule II controlled substance prescription that is an opioid. And that is if it's written in Arizona to be filled outside of Arizona. And if it's for medications that require compounding of 2 or more ingredients, also for medications that are not in the e-prescribing database, and also for medication-assisted treatment, MAT, that most of you know it by, for substance abuse use. More things from House Bill 2075. A prescriber may write and fax a Schedule II controlled substance that is an opioid if it's being dispensed to a Veterans Administration facility, a healthcare facility on a military base, Indian Health Services, hospital or service facility, and also tribal-owned clinics. And you will all pick up on the fact that this is federal. Anything federal, you can write it. And I caution you to make sure if you are doing federal prescriptions that you should call the pharmacy that it's going to be sent to. Some of the federal pharmacies can accept an electronic prescription. Others, you will need to write it. I advise you to call the pharmacies that you basically deal with in the areas so that you know exactly what to do. You also need to let them know that you will be prescribing in written format so that they can take, so that they will agree to take your prescriptions.
Now I got to figure out how to download this thing.
Also, House Bill 2075, you may write for any of the controlled substances that is an opioid in any of the following situations. To be compounded for direct use for any of the items listed below, also for a resident in a long-term care facility, also for a patient who is enrolled in a hospice program licensed by the state of Arizona. So it's important that you make sure the hospice program is a licensed program in the state. And you must note on the prescription that you hand write that it is for a hospice patient. The reason I've included this is I've had a lot of questions about when can I write, when can I fax, and so I've given you a lot of information in the last couple of slides about that. If you have questions about it, you can ask me about it and or go back and look at the slides. Also, you can write and fax for a situation when your system or the pharmacy system is not available in a timely manner. If you do that, be sure that you write on the written prescription that your system was not operational or available and why, and also be certain that you maintain a record of it and make sure that you keep all the pertinent information, like when was it down, how long was it down, all those kinds of things. I know that the Board of Pharmacy and some other work groups are working on defining what the exact requirements are for the records that you must maintain. Now I would advise you to keep whatever you can, what your system is, when it went down, when it came back up again, what pharmacy you sent it to, so that you have all the information should you be questioned about it. Additional mandates. You can do emergency quantities of Schedule II controlled substances and you can have them dispensed on an oral prescription, so you can do it orally if it's an emergency situation. So it must be immediately, if you do an oral, if you end up calling a pharmacist and saying maybe there was a bad accident where you worked and you were able to take care of some people and you wanted to orally prescribe some pain medications, you can do that. But the pharmacist then must immediately transcribe it to a written order. And within 7 days, the medical practitioner, the one who called it in orally, must write it and then manually sign it and send it to the dispensing pharmacist. And you can also electronically prescribe it rather than writing it. But you must make a note on that electronic. There's usually a note area in the software applications that allows you to write the note in that this was an oral prescription called in on such and such a date, so that the pharmacist knows where it is. And also those oral prescriptions cannot be refilled. So it can be, you should do it for a very small amount and understand that it's not going to be refilled, won't be able to be refilled. Also, some additional mandates. Prescription orders for controlled substances cannot be dispensed for more than 90 days after the date on the prescription order. So if you write a prescription today, give it to your patient takes it home, and they want to get it done 90 days from now, they won't be able to do it. If it's over 90 days, they won't be able to do it. And if it is a electronically prescribed prescription, it also cannot be filled by the pharmacist if the patient comes to pick it up after 90 days. The pharmacist may sell and dispense Schedule II controlled substances if the practitioner or the prescriber is located in another state. But the prescription must be issued in accordance with the compliance of the laws of the prescribing person's state and federal laws. So that can be a bit of a difficulty for folks for the pharmacists in Arizona, especially when you are on the borders of other states and you get crosses of prescriptions. So my advice to you is to work with some of the providers and the prescriptions that you're receiving from out of state so that you make sure that you're covering the laws that are in place for that. Also, it could happen that you will get a written prescription from a snowbird, some of our folks who spend the winters with us, so you may need to do some investigating in those folks as well. I'm going to cover a bit of board-certified physician assistance limits and requirements, simply because the original Senate Bill 1001 that was assigned in 2018 had some erroneous things about the abilities and limits for physician assistants. So a physician assistant may not prescribe without a delegating supervised physician, board approved, and be a DEA registered. So the supervising physician needs to be DEA registered and be board approved, and also the physician assistant must be board approved and a DEA registered. That's really not all that hard to do, but it's important to know that both ends of that are important. Prescription privileges with delegation. So if you have a delegating supervising physician, you can do 30-day prescriptions for Schedule 2, 3, 4, 5, and 5 controlled substances that are opioids or benzodiazepine. You also can do a 90-day prescription for 2, 3, 4, and 5 controlled substance prescriptions that are medication, for prescription medication only. 90 days for those prescriptions only. And I've got one more, that prescription-only medication is supposed to be part of that last bullet. Sorry, I'll have to fix that one. Also, board-certified physician assistants cannot prescribe medication intended to perform or induce an abortion. And the reason that I included it is several, or a lot of physician assistants also operate as midwives, so they have to be careful that they're not using the prescription to induce an abortion, and that's kind of important for those folks. Also, a controlled substance prescription cannot be for over 5 times in a 6-month period for each patient. Cannot prescribe controlled substances that are opioids or benzodiazepines that are refillable without a written consent of the supervising physician. And again, I've not been told by the board exactly what that means. If you have to write on the prescription, put it into the notes area, I'm not sure what that means. And as soon as I have that information, I will get it out to you folks. Also, a physician assistant cannot prescribe prescription drugs that are refillable for a period exceeding 1 year. So the prescription you write cannot exceed 1 year. More physician assistants. To be certified to be able to EPCS in the state of Arizona, you have to have 45 hours of pharmacology or clinical management of drug therapy within the past 3 years. Or you can be, stop my phone here. Or you can be certified by a National Commission on Certification of Physician Assistants, either one of those. Some more limits, requirements. You must issue your prescriptions under your own DEA registration number. You can't use your supervising physician's DEA number. It must be your own, so you have to have your own DEA number. You may not prescribe Schedule 4 or 5 controlled substances more than 5 times in a 6-month period for each patient. And you must have supervising physician's written consent to prescribe refillable Schedule 2 and 3 controlled substances that are opioids or benzodiazepines. And again, I'm asking the board for more specific information about that line, about that bullet point, so they can share it with you. So watch the EPCS newsletters that I send out. If you aren't signed up for the EPCS newsletters, either shoot me an email or go on the website and sign up for them. Physician assistant may not prescribe prescription-only drugs to be dispensed, prescribed, or refillable for a period longer than 1 year. And I put this bit of information in about pharmacists so that you understand. I don't usually have very many pharmacists on these calls, but I wanted to let you know what the pharmacist is required as well. When the EPCS system is down or unavailable on the pharmacist end, he or she must also maintain a record of when the system was down, what system it was, and why, if they know what the failure is and when it came back up again. And pharmacists may fill handwritten prescriptions for veteran administration, health facilities on a military base, Indian Health Services, hospital or service facilities, and also tribal-owned clinics. And I put a little bit more information in here about veterinarians, which we talked about a little bit before, and also for MAT, which is the Medication Assisted Treatment Program, does not need to be electronically sent, just so you understand that at this point. So that is the portion of the session that covers the mandates, but I also wanted to share with you some interesting information and some exciting news about Arizona and where we stand. First of all, I was absolutely delighted to see in the SureScripts 2018 National Progress Report that Arizona, had jumped from 22nd to 11th place, which was, for the month of October, the largest, for the year 2018, the largest jump that was taken in the United States. And the reason is, you might say, well, what is she doing here? We're at the end of 2019. Why is she telling us about 2018? SureScripts puts out a national progress report once a year, and it usually comes out in July for the previous year. So we won't get 2019 until July of next year. But I was really, really excited to see us do that because I don't know if some of you might remember that back in 2013 I led an initiative to let everyone know that electronic prescribing of controlled substance was made legal in the United States, in Arizona. And so this has been, in the beginning, we were 5 in e-prescribing, just e-prescribing, not controlled substances, just e-prescribing. And then we went way down to like in the 40s. So I'm delighted that we're back up to 11th place. So what does that mean? Here's a little bit of information that I was able to get on October for statistics from October of 2019. Nationally, pharmacists, 96% of pharmacies in the nation are EPCS enabled. In Arizona, we're at 99%. And the ones that are not are basically the federal facilities. And also there are a few outlying mom and pops that are not EPCS enabled. And also a few pharmacies that are in some of the remote areas that are unable to get a decent wideband or Wi-Fi band. So that's basic. So we basically, all of our pharmacies, all the big guys, the Walmarts and the Fry's and all of those folks are all EPCS enabled. Prescriber is EPCS enabled, and nationally it's at 44. In October, we were at 63%, which is really great. So we're 19% ahead of the national numbers. So I was really excited about that. Then, as of October 2019, Arizona ranked 4th in the nation for EPCS prescriber readiness. So we're really moving along. I've given you the source of this, so you can go on the website here by following the link at the bottom of the screen. Click on our state within that map, and you will be able to see where all of the different states, where they all stand and how many of their prescribers are actually EPCS enabled. Great news, great, great, great news. And this slide I put in here because those of you who are not yet live, you need to understand that half of all states require electronic prescribing for opioid controlled substances, or some of them even for all prescriptions. And there is a bill before the National Congress and House that's looking to have everyone have to be required to electronically prescribe for opioids. So, you know, we all need to get on the bandwagon so we can go ahead and meet all the compliances. But the reason for this slide is to let you know that if all of these states are requiring to be electronically prescribing, everybody that's a prescriber is out there looking for software. So the vendors are going to be busy, and the vendors are going to be backed up. So it's extremely important to get on the phone, get with your vendor, find out where they are, get into their schedule. You may think, here's another thing that I've seen folks run into, they may think that their EHR system has a certified EPCS software module that they can obtain, and it probably does, but they may not, your electronic health record may not be up to the version that is required to be able to use the EPCS module. So you need to get on the phone and get going if you aren't already. Call me. I'm happy to help you if you have questions. Arizona, this was interesting. I found this information a couple of days ago, and I thought I'm going to stick it on a slide and let you all see it. In the state of Arizona, there are, as of November, there are 25,670 DEA registrants. There are, so that's how many registrants, there DEA registrants there were in November of 2019. If 63% of them are enabled, that leaves 16,172 that are enabled. 37% are not EPCS enabled. So that means 19,498 Arizona practitioners have 28 days until the January 1st, 2020 mandate becomes effective. So we need to get moving here, guys, or we're going to really be in trouble. Now, I will grant you this. There are a few of those 19-plus prescribers that are registered but no longer prescribing opioids. So they have a DEA license, but they have no need to e-prescribe, so they don't need to be compliant. They don't need to have software to do it. I've been asked that question as well. What if I don't prescribe opioids? Do I still need to do EPCS? The answer is no. You do not need to do anything if you don't prescribe. So, and there are a bunch of other retired folks who haven't given up their license, EPCS, DEA license. So there are a bunch of different reasons why. Now, I couldn't find, you'll notice the very bottom line on the slide, it says 11,253 DEA mid-level practitioner registrants. I couldn't find how many of those actually are compliant. I couldn't find any information on that, and they, just so you know, they are not included in the 25,670. So that is 11,253 additionals that may or may not be up in line. As soon as I find any information about it, if I can find any for mid-level information, I'll get it into a newsletter. But anybody that needs to get moving. So also, I want to cover some of the information for the Click for Control, where you can find the resources. You can find it on our website. You'll see the link to follow there. What you find out there is a lot of information, some articles, in-person EPCS presentations from conferences and staff meetings, and so on. And also the slides that you can add to any presentations. So if you need to do any in-person EPCS presentations, like at a conference, if you want to include some, I can provide you with some slides to add to any presentation so that you have the information you need. Sometimes when someone is speaking to a monthly staff meeting, you might want to include a couple of slides in it. I can provide you with those. And also, I'm available, as are other folks from Health Current are available to do in-person EPCS presentations. Anytime you'd like, just give a call and we'll be happy to do it. Additionally, we do phone-based assistance and also email assistance. So call me. I always tell everyone, call me, don't struggle, because if you have a question, most likely someone else has asked that question at this point, and I'll be happy to help you. Just don't struggle. Call me. I can help you get to where you need to be. You will find some fact sheets and flyers on that you might want to be able to hand to folks. One of the things I suggest, and I don't have a flyer out there like it, but I'll be happy to help you with it if you decide to do it. If you're going to start prescribing EPCS, you might as well prescribe all of you might as well do your regular legacy prescriptions electronically as well. It's a good idea when you do electronic prescriptions to hand something to your patient, because your patient most likely is used to walking away with something paper in their hands. So if you then provide them with this paper that explains what is e-prescribing, how is it, what's the benefit to you, and all those kinds of things, they'll have a better time of understanding what they need to do with it. Also, we've included Dr. First are going to be presenting today. Eric will present today on the Dr. First software, and it will include, which many of you have asked about, is the smartphone option of being able to have it on a smartphone, and Eric will talk about that in a bit. Upcoming webinars, which are also on our website, or you can click here to register. Today I did the Understanding the New EPCS Mandates. Thursday the 12th will be the written electronically transmitted prescription requirements, and then on the 18th, Lynn Curtis from the Board of Pharmacy will do the Controlled Substance Prescription Monitoring webinar. I've given you a few of the benefits of EPCS that you might want to share with your prescribers. Closing remarks, I'm not going to go through so that I can let Eric on so he can do his session. I also want to caution you that this webinar is presented to educate and help you. So if before you act on any of it, I encourage you to review and interpret the legislation and mandates based upon your specific situation and needs. And if you have questions about that, call me and I'll help you with it if I can, and or send you to who will be able to help you. Here's my contact information. It will be in the slides that you receive. Please feel free to go ahead and call me or email me. If you are interested in joining the HIE, the Health Information Exchange, I've given you the recruitment at healthcurrent.org, or call the phone number listed there. That will help you understand more about the Health Information Exchange if you are already not a member. And that is my presentation. So before I turn it over to Eric for his presentation, I want to let you know we will be answering your questions after Eric's presentation. So let's give Sarah a few moments to switch it over to Eric. Eric, are you on?
I am here. How's it going?
All right. Thank you so much for joining. Eric, I can never say your last name, as you know, so I'm going to introduce you as Eric, and you can say it if you want to.
That sounds good. No, thank you. My name's Eric Zimbam. So, yes, not the easiest, but yeah, I'm with Dr. First, and bear with me so I can share my screen here. And what I'm going to do is I'll go through, just give you an example of what all of this looks like in terms of sending prescriptions electronically via an app or on your PC. Just very brief background, Dr. First, why we're involved. We worked with the DEA in 2010 and essentially created what's considered the EPCS market. So sending these controlled medications electronically. And so that's why we are involved. I myself have been with the company 6 years, was with IBM for a number of years, so I've been doing healthcare IT for a long time. Manage the ambulatory, they're the team that handles ambulatory, hospice, small hospitals, that kind of thing. So you will more than likely, when you call in, either speak to myself or one of my team members. So just so you know who the heck we are and why I'm talking. But what I have got here is, first what I'm going to do is I've got a brief video to show you what the app looks like, and then I'll do an actual demonstration and walk you a little more in depth on the web side of things, can show you how to send a controlled med, that kind of thing. But what I will do is I'm going to enlarge this, so bear with me as I make this a full screen. There's no sound. I'll just kind of talk as we go through the video here. It's 3 minutes long. But like I say, this is showing how you can send prescriptions from your smart device. The app will work in conjunction with the web service, so you can work on either one. So if you enter patient information, etc., one will show up on the app. it'll also show up on the PC side of things. So here it's going to go through, show you how to do a new prescription. What you're really going to notice is everything is very intuitive. Kind of the smart device in the sense of you just have to type in a few letters. It will pull up the medication. As you can see, it's going to give you dosage amounts, whether it is extended release or immediate release, etc. You will put in the quantity. And as you can see, I mean, it's pretty self-explanatory. This is all very intuitive. It'll lead you in the right direction on how to use. Once a patient is in there, they will always stay in there. Once you've entered the patient and some basic demographics in real time, we will then in turn provide pharmacies they've typically gone to, their formulary information, medications they're on. That would include other doctors they're seeing. So you get a real good snapshot of what is going on in terms of the medications they are taking. So here you can see in the example, it's going to pull down the oxycodone. It will provide instructions to the patient. And then at the final step, it will show what is called the two-factor authentication. So a lot of folks have heard about that. I'll show that a little more in depth when I do the demo, but this gives you, like I say, an example of how it is done on the app. So here you can see they've picked out the medication for the patient. They're going to send. It's going to route them and recognize that it's a controlled medication. So you're going to enter a passphrase, which we help you create when you establish the account, and then a PIN number. So this is a 6-digit number that's provided to you on what's called a token. It's associated to your MPI. And there again, this is provided to you at the time of, when you initiate the service. And so for my example, I actually have the token on my phone, but it serves as the same function. So, and then what you see here is that once you actually send the prescription, you can send a quick message to the patient. Check in on them, make them aware that the prescription has been sent to the pharmacy. If there are coupons or information regarding that medication, that will also be in the communication when you send that. But it's not an open line. So if you reach out to a patient and connect with them, they can respond at that point in time, but they can't just start texting you at any point in time. That link will end. So that will save you the headache of somebody doesn't feel good at 1 a.m. and then they just feel like they need to reach out to you. So anyway, that gives you kind of an example of what the app looks like, how the medications are sent. Pretty straightforward. What you're looking at now is actually what the interface looks like when you're working on the computer, on your PC, laptop, etc. And so a big kind of a workflow, and I'll go through this too, but a big workflow feature that people like is the provider can have as little input or involvement as just releasing the controlled medication, while the staff can essentially be doing everything else. Enter patient demographics, queue up medications, which I'll show you here in just a moment. So how this really works together is, let's say the staff is in the office, they queue up a medication, the provider is off-site, but then they can go into that app and release the medication. So it provides a lot of flexibility. What you're looking at here is the patient page. Everything will be located on one page. You won't have to flip around. So once you're on with the patient, this is what you're looking at. And so just kind of going from top to bottom, you've got the patient on the left side, pharmacies in the middle. So this would be all the pharmacies that they typically go to. All the pharmacies in the country, mail order, et cetera, are in the software. So you can search for these based on zip code, town, name of pharmacy, et cetera. Here on the right-hand side is their formulary information. We will pull this up and provide it to you once the demographics are in. It's not for billing purposes, but what it is doing is it's giving you And what do I say? It's giving you the information saying, does the insurance company cover this medication? If it doesn't, we will provide a generic alternative. And so I'll show you an example of that as we go through this. And then we take it a step further now as well that, okay, great, now you've got the medication, and we are now going to pull up, basically a box will pull up right here in the middle of the screen and give you the pharmacies Kara Whiteside typically goes to. And once we prescribe the medication, it will give you the pricing at all the different pharmacies. So you can guide them to where it is most economical based on their insurance coverage, et cetera. Give a little more, I guess, patient satisfaction, as you will. So going to the middle of the screen, here is the medication history. So these are the meds that the patient is on. This is going to come from all the doctors they're seeing. So we're pulling this info in. And again, this happens in real time once you put in some basic demographics, those being first name, last name, date of birth, gender, zip code, and the phone number they use. When you're prescribing controlled meds, obviously you have to put in the complete address, but with that basic info, we will in turn provide, like I say, the med history, pharmacies they go to, and then their formulary. This is a demo account, so yes, I have got Kara on all sorts of screwy medications. This is for demonstration purposes only, not obviously prescribing all these C2 meds to this woman, so that I will go through and how you actually prescribe the medications here in just a sec. Right below here, you can, though, add allergies. You can add diagnosis as well. Not required, but that's an option for you. And then down here is where the prescription will be pending. So what I'm going to do is there's 3 ways to prescribe. I'll point out each one here. I'm going to start with a renewal. Most common, you've got the patient that you're currently seeing. They need to actually renew the medication. I'm going to use Adderall. I use Adderall a few times simply for the sake as it gives the best demonstration. So I know it will be redundant, but that gives a good illustration of what I'm talking about. So check mark the Adderall. I'm going over to the right-hand side over here where I'm circling. I'm clicking this renew icon. And now this medication is going to pull down and queue up at the bottom of the screen. So this has popped up. This is what I was just talking about, the formulary alert. It might cover the brand name, which it looks like it does, but then it will give you all the alternatives of other medications that can be used that are similar, that are also covered by the insurance. So I'm down here at the bottom of the screen. I'm going to click prescribe anyway. So you get those different alerts throughout, and they simply pop up. But like I say, you just click that prescribe anyway button and keep moving. So now this Adderall, we're on the same page. I'm at the bottom of the screen. The Adderall is now pending. So this will stay here indefinitely until you either send the prescription or you just cancel it altogether. And so this is the workflow benefit of what I was saying. Staff can queue this stuff up so then the provider can go back whenever it's convenient and release these medications. So what I'm going to do now is I'm going to enter a signature password. I'm going to send, click the send button. If this was a non-controlled, let's say like amoxicillin, et cetera, it would have gone straight to the pharmacy right then and there when you enter that password. Since this is controlled medication, it takes it a step further, and I'm now doing the 2-factor authentication. It kind of brushed over that in the video, but this is the key to being able to send controlled medications, is you have to have this 2-factor authentication part. So what I'm going to do is I'm going to enter a passphrase. This stays the same. You create it when you establish the account. And now I'm going to enter a 6-digit token number. So bear with me. What I'm actually doing is I'm logging into my iPhone, and it's giving me the number of 819702, and I'm going to click sign. So all you do is just enter the number that it's being provided to you at that time on your token. So now the prescription has been sent. I know this because I see right here confirming that the last date this was written is December 4th. You also will have the capability of pulling reports gives a little more in depth on all the prescriptions sent, and it will provide timestamps, initials of who sent it, etc. So yes, you'll see it instantaneously in the med history here, but you can also, like I say, pull a report. You can print this stuff up, but it will indicate, okay, it was sent to whatever pharmacy you send it to, and verify that information. So that's how you send a prescription. That's how you renew it. If you were starting with a new medication for somebody, there's two ways you can send that. One right here, I'm at the top kind of upper left-hand corner, this star. I'm going to open this. And what this does is you create favorites. So now you can create favorites based on practice. You can do it as terms of provider specific. And then you also have the most recent medication sent. And then all you're going to do is actually click on the dosage or quantity amount that you want, and then that's going to pend that medication. And so you will just go through those steps again. I would click on this. It will pend at the bottom of the screen. Let me show you what that looks like. I'm getting that alert again. And now this is queued up and at the bottom of the screen. And then I'll show you the two-factor authentication in just a moment. We'll send these medications. But then the other way you can do it is right to the left of that star is create new prescription. So we can start this from scratch. And like I say, sorry to be repetitive, but I'm going to use the Adderall again. I'm just going to type in the first few letters of the medication. It will then start to pull up medications that are spelled with those letters. I'm going to pick the Adderall, the immediate release, and then it gives me all the dosage amounts that I can choose from. And then here it will give me a snapshot that the brand is not formulary, but the generic is. Again, pointing you in the right direction on what meds to use based on the insurance coverage. So I'm going to use the 20 milligram, and then we get an alert saying it's duplicate therapy. So there are alerts in here. This is built into the software. So whether it's giving you a heads up that it's been duplicate therapy or a drug-to-drug interaction, a drug-to-diagnosis interaction, etc., that's what it will look like. It will simply just pop up for you, give you a heads up, but you can go ahead and prescribe anyway. And I mentioned earlier that when you pull the medication, it will also pop up, and it looks just like that. That box will simply pop up and let you know the price of the med at CVS, Walgreens, etc., and it'll give you that information. So now we're just starting from scratch, and all this is in the drop-downs it's just the information that you would normally put on a prescription pad. And so you're just filling in via the drop-down options. So that's all I am doing here. What you can do is you can put in specific directions to the patient and pharmacist. Take with food. And then down here, if there are specific directions to the pharmacist, you can do that. This is how, if you deal with compound medications, you can create the compound via this, the directions to the pharmacy. On this screen, too, you can split and do multiple prescriptions based on insurance coverage. If you needed to do, let's say, a 60 or 90-day supply, you can send the first script to the local pharmacy, and then the second one to a mail order pharmacy. And so you can do that all at once, and you do that from this page. So there's some basic information on how to take the medication. I'm going to click review. I'm going to prescribe anyway. And now it takes me to this page. And basically everything in this border here is what is going to show up on the pharmacy side. So nice and legible, and all the specifics on taking the medication. So I can send it from this screen. What I'm going to actually do is I'm going to save and pen this. We're going back to this original patient page. So now you can see that I've actually have this medication queued up twice. and so it is now pending. So what I'll do, bear with me, I'm going to, actually, I'll just uncheck that. So I'll send this 10 milligram again, just to run through. I want to show you the two-factor authentication process again. I'll get an alert. It will ask me, do I really want to send this at the end? I'll cancel it, but just so you can see the token info. I'll click send. And so now here I am back to this two-factor authentication process. And then the token, bear with me, I'm logging in. And so now the number I'm getting is 221924. I'm going to click sign. I'll get this alert letting me know that, do I really want to send it, etc. So I'll continue. And so now it has been sent. I see the Adderall 10 milligram, and it was last written on 12/4. So I see that there. That is, yeah, I mean, that's how you're going to prescribe. Again, you know, real intuitive after your first few prescriptions. You'll be able to navigate through this fairly easy. There's other bells and whistles, like there's e-prior authorization, so you can contact the insurance companies via, you know, electronically versus fax or phone. Two other items I want to point out. Up here in this upper right-hand corner, you can see this bell. So this is where the pending prescriptions are. So if you've got staff queuing them up, but they haven't been sent, this is where the provider would go to. They would go, they'd click on this bell icon, and then you get a list of all the patients waiting for their medications to be sent. Non-controlled prescriptions, you can send in bulk. So you can send all the patients and all the medications for non-controlled all at once. Controlled medication, it will make you add the token number for each controlled prescription. That is a DEA regulation, so you're going to have to do that. However, as you can see with Patient Burger King here, you can, if they've got multiple controlled prescriptions, you can send that in bulk if it's all for the same patient, to give you an idea. So. And then the other item I wanted to show, and unfortunately it doesn't look like I have any refills, but you would click on this icon, and if the patient goes back to the pharmacy, now I know if it's controlled medication, they need to reach out to you first, but let's say if it's non-controlled med, they go to the pharmacy and ask for a refill request or renew. The pharmacy will communicate to you electronically, and then it will show up here that there's renewals awaiting. So I apologize, I don't know where those went in my demo account, but same idea. I would click on that, and now I've got a list of all the renewals waiting with the patients. And then what will happen is you can then go ahead and approve them. You can deny them. You can type a message back to the pharmacy, hey, have the patient call me to renew, etc. So I'm going to go back to the main patient page. Like I say, that's really the gist of it. All of this stuff you can print out, you know, if you need to for files, anything you do. But yeah, that is how you're going to use the product. That's what it looks like. And so I'll open it up to any kind of questions you have. Oh, and while we're waiting, what I will do is I'll put up my contact information so you have that as well. In case you've got questions, happy to answer. And any questions, feel free to call or email me. But yeah, Connie, I don't see the comment section, so I don't know if you're seeing any questions, but if you do, let me know.
Hi, Eric, I don't see any questions in the chat box for you. So, and I believe we have a couple questions that I've answered online, and I will ask Dr. Anna Nordin to contact me directly so that I can help her answer the questions she has. Other than that, that is everything for today. Thank you all for joining. If you have any questions or need some assistance, please don't forget to get a hold of us and watch your email. You will receive a copy of today's webinar slide deck and the question and answers during the call. And also in about a week, you will be able to go and look at the live webinar on the Health Current website. Again, I thank you all for attending and good luck. Let me know if I can help. Don't struggle. Thanks, everyone. Bye-bye.